Good morning, students. Today we are going to see one more topic, applied topic of respiratory system, deep sea diving and decompression thickness. Very commonly a question, part of long answer question and a short answer question separately are asked on this particular topic. So this is a very important topic. So we are going to discuss deep sea diving and decompression sickness. Now let us see what are the different pressures and what happens to the gases at below the pressures. So atmospheric pressure at sea level, we have seen that it is around 760 millimeters of mercury, or it is said as 1 atmospheric pressure. Now in the last session, what we have seen is whenever the pressure is increased, be at high altitude or very high altitude at the space physiology, what happens to the body. And what we are going to see now is if we are going below the sea level, now the pressure again will change. And due to these pressure changes, the gases will be acting differently. And how these gases can affect the body. The gases which are inhaled at high pressures to equalize the external pressure on thorax so that adequate expansion occurs. So whenever they are going down, there is a high pressure. Deep sea down, the pressure will be increased. As we go up, the atmospheric pressure will be reduced. Whereas if we are going down into the sea, the pressure will be higher. Now these inhaled gases, they has to be equalized inside the body, right? Whatever may be the atmospheric pressure, they has to equalize. So they try to equalize with the external pressure on thorax, so that whatever expansion which has to occur to continue the respiration, that will continue. Now these inhaled gases at high pressure, they will dissolve in the body at high quantity. So what we have is high pressure of these gases, and whenever they are trying to equalize the pressure, they will get dissolved in the body. So that happens at the deep sea level. Why? Because it follows the Henry's law. The Henry's law states that at a given temperature, greater the partial pressure of a gas, greater the amount of that gas that will be dissolved in solution. So whenever you try to increase the partial pressure of any gas, the amount of the gas will be dissolved in the solution, and it goes on accordingly as the partial pressure goes on increasing. So if we are going deep down into the sea, the partial pressure of gases will go on increasing, and the gases, the inhaled gases, they will try to dissolve in the solution. Now you know that inside our body, what are the solutions? So we have the blood, the body fluids. Now these fluid part, in that particular area, the gas will be emerged out and it will try to dissolve. Now this is not normal physiological situation. Due to dissolving of these gases, hazardous effects on the body will occur. Now we are going to discuss what happens. Now, to make it sure, this is a common thing which you, all of us are like experienced. The appearance of CO2 bubbles when removing the cap from a carbonated beverage bottle. So we have this beverage bottle, which is carbonated beverage bottle, and whenever you are removing the cap, so what happens is the bubble formation is there. Why? Because there is an increased partial pressure of that particular gas, and it will try to dissolve in the solution, and that gives out the bubbles. With the cap in the place, the gas remains dissolved under pressure. So removing the cap suddenly reduces the pressure above the fluid and causing the bubbles to form. So these are the examples which we can commonly see that how the gas will be acting whenever there is a change in the pressure. So this is a common example which I have given. Coming to our topic, that is decompression thickness. It occurs when dissolved nitrogen moves out of the solution and forms bubbles in the body tissues and the fluids. So what we have is it is dissolved. Now nitrogen is dissolved inside, and then it tries to come out of the solution. So it is inside the lungs, but now it tries to come out as the pressure goes on increasing, and it will try to form the bubbles in the body tissues and the fluids. When it occurs, whenever there is ascending to the surface too rapidly, following a deep and prolonged dive, which is often made possible with double and triple air tanks. So what these divers they do, they go for deep and prolonged dive. And these prolonged dive, because diving it has a certain area up to these many foots you have to go, and the time is also given, a sorted time is given, and that if you are crossing. So how it is made crossing, you can provide double or triple air tanks. So many things are happening in the sea, and we have so many workers there, which are those who are working under sea. So they will allow to have a deep prolonged dive with the help of double and triple air tanks. But after that, if they are trying to ascend to the surface too rapidly, so this changes the pressure, and like the opening of the cap of aerated fuel, this will happen. So it is coming out, the gases are coming out from the body, and suddenly there is a pressure change. Now the gas inside will cause the bubbles in the body tissues and fluids. So nitrogen reaches the equilibrium slowly in many tissues. So it will form the bubbles, and then it will try to reach out the equilibrium in many tissues. Most commonly the fatty tissue is affected and slowly leaves the body. So generally it is seen that women who have greater average percentage body fat than man and the obese men face the greater risk for decompression sickness. So it is generally seen if your fat percentage inside the body is more, as which is normally there in women and obese men, the risk of decompression sickness will be much more. So what will be the disorders after knowing these pressure changes and what exactly it is causing? The first disorder it causes is dysbiotism, which is often known as Cason's disease. Second is nitrogen narcosis. Third is acute oxygen toxicity. And the fourth is air embolism. So deep sea will be having all these factors. One by one, we are going to discuss this. So, what is Cason's disease? It is also known as dysbiotism. This is also known as diverse bends, diverse palsy, or decompression sickness. So, any of the term can be asked in the examination. So, these are the same. Dysbiotism, the diverse bends, the diverse palsy, and decompression sickness. Most commonly, the Cason's disease. Why it happens? Due to rapid shift of a person from a high atmospheric pressure area to low pressure area. It has gone down. Now it is trying to ascend very fast. So there is a rapid pressure change from high to low. So it happens commonly in deep sea divers and those persons working in Cason. Now what is Cason? This is known as Cason's chamber. It is created inside the sea. So to see deep down, it is having the rock, the mud, then you have the water phase, and these are the chambers which are formed inside the sea. And the persons they are working in the sea. Well, most commonly, like the mines, the petrol, the oils, they will be working here for these things. So that is a Cason's chamber. Now, this decompression sickness is a condition that occurs when divers come back to the surface too quickly after being deep underwater. And it is caused by the formation of nitrogen bubbles in the bloodstream, and most worst cases can cause death. So divers generally they breathe 80% nitrogen underwater. Nitrogen under such high pressure gets dissolved in water. So what we have is normally the 80% nitrogen will be there, and that will be dissolved in the blood, and that gets accumulated in the tissues and fats. Now during slow ascents, these dissolved gases gets eliminated by lungs very slowly. So if you are attending slow, then it will be dissolved or eliminated by lungs slowly. But in cases of rapid ascent, it causes formation of nitrogen bubbles. And these nitrogen bubbles are causing the symptoms. And what they are causing, the first thing is there will be inflammation. The gas tissue interface can activate the complement system, the inflammatory pathway, and activate the inflammatory cells also, leading to an acute inflammatory response. So this is the first thing which is caused by nitrogen bubbles. The second is that can cause the obstruction to the blood flow, which is leading to ischemia and then infarction of the tissue and organs. So completely there will be loss of blood supply. The gas-blood interface can also activate the clotting factors, and that leads to intravascular coagulation. So inside the body there will be coagulation which is occurring, intravascular coagulation. And this coagulation will lead to form the emboli. The bubbles will form in the blood and that can disrupt the blood. So these bubbles will stop the blood supply to the tissues either by way of forming the emboli or they can cause the ischemia. The bubbles which are within the cells, they can damage their internal structure. The cells itself, the cell structure itself will be damaged and that leads to loss of function of that particular cell. So finally, the cell will be losing its function. Now, if the large bubbles are formed, they will be in the vasculature and many vessels will be ruptured. And so they are so much of large size that the vessels also get ruptured if they are inside the other spaces. Say, for example, any tissue like lungs, they also tries to rupture that particular tissue. So if large size bubbles are formed, they can directly cause the tissue rupture. These large bubbles, they also can compress the surrounding structures and then they will cause the damage and leading to loss of function. So whenever the bubbles are formed due to the rapid ascent, these are causing the hazardous effects on the body. Now, it usually appears after half an hour after reaching the sea level. So these are due to bubbles in the musculoskeletal system, bubbles in circulation to brain, spinal cord, heart. So these all systems will be affected. So the blood flow is affected, the tissue is affected, the cell function is affected. Then it can cause bubbles in the pulmonary circulation. Fat people, as we have already discussed, they are more prone to this parasite. So they have more hazardous effect. Very fast they can have these particular complaints or symptoms. Then there will be bends, and diverse bend is the complaint which is commonly seen. And what is that? It's they will feel pain in the joint and muscles. And this particular symptom is known as diverse bends. Then it can lead to numbness, it can lead to coronary ischemia, and that leads to myocardial infarction because there is a emboli also, there is ischemia also, which leads to blockage of coronary arteries. It also can affect the brain by causing dizziness, unconsciousness, and many a times paralysis. So the person cannot do anything, is not able to swim, not able to take the decision. The musculoskeletal pain is the common symptom occurring in up to 80% of the patients, and it can range from middling aches to severe joint pain and muscle cramp. It most commonly affects the upper leg. So this is the most common symptom which is observed. The neurological symptoms are varied but very dynamic. Spinal symptoms are more common, including lower back pain, lower body paresthesia, or may have lower body paralysis. The symptoms include psychological changes like intellectual impairment, visual impairment, or autism. The oral symptoms like labyrinthine symptoms, including nausea or typo, nystagmus, and it can be combined with hearing symptoms, including hearing loss and tinnitus. So these are again very commonly affected. This particular symptom is also seen at high altitude. So if you are comparing both of these, see whenever there is increase or decreased pressure, or whenever there is a change in the behavior of the respiratory gases, and this is causing effect on mainly the CNS. You must have heard that at Mount Everest, many of the people, they say, we have seen something, and they have noted that these are the things we just seen. So we are not sure whether these things they have seen are real or they were uh, like symptom which was hallucination. So same thing happens here also. There will be hearing loss, there will be tinnitus, and there will be confusion and dizziness. Skin rashes are very common. Mottling and marbling of the skin may occur, occasionally progressing to an orange peel-like discoloration, and may be associated with itching or burning sensation. The respiratory symptoms are chest pain, non-productive coughing, and may progress to severe dyspnea and respiratory distress. It can lead to hemoptysis also, that is vomiting of blood. How we can treat this? So we have these common symptoms. We have seen that it is affecting almost all the symptoms. So how we can prevent or how we can treat it? The first and the most important is slow decompression. So what we have to do is why these are occurring because the diver is going up or ascending up very fast. So you try to avoid that. We have seen at high altitude, we have seen that there is an acclimatization. Here also, the acclimatization has to occur, and the acclimatization is in the phase of slow decompression. So what we have to do, slowly you will try to ascend. That is known as slow decompression. And to have an ease for this slow decompression, we have the decompression chambers. So those divers who are going deep inside the sea and working for long hours, what they have to do is whenever they are ascending, they will have a decompression chambers. And these decompression chambers, we have to go inside these decompression chambers, wait for some time there, whatever time is allotted, and then again slowly try to ascend. We can also have the treatment of hyperbaric oxygen. The recompression is followed by slow decompression in the compression chambers, which is given like this, like 10 minutes, 50 feet depth, 50 minutes at 20 feet depth, like this. So total 3 hours we have to follow the decompression or slow decompression, and the time and the height we have to give like this. Now there are one condition which are known as zero compression limits. So any single dive that falls on the left side of the curve. So there is a curve which is if the dive it is measured, it is given in the all the divers and the chambers or these captains. These graphs are there. So any single dive and they have to follow the diving process of all of the divers. So if single dive that falls on the left side of the curve requires no decompression, provided the rate of ascent does not exceed 60 feet per minute. So what we have to see is that rate of ascent is not crossing 60 feet per minute. So they will not require decompression. So on the left side, so on this side if it is there. So this is the diver's depth and this is the diving duration. But dives on the right side of the line, they will require the decompression period as specified in the standard decompression tables. So what there are decompression tables which we have seen on the last slide like that. They have prepared the decompression tables, and those divers who are falling in this particular range, they will require the decompression, and for all the divers, for every month, we have to prepare these decompression tables. And these are the decompression chambers which we have. So this is the chamber and this is the inside of the chamber. So you have to be for the specified time for the specified time and at the specific height. Now, acute management is a medical emergency. So prompt resuscitation measures we have to do for saving life. And the first prompt resuscitation measure will be administration of oxygen. So 100% oxygen should be administered via a mask. This will improve the oxygen saturation and that will supply to all the ischemic tissues. So whatever hazardous effects of decreased supply that will try to accept it. Then warming. Wetsuit should be removed. Passive rewarming of patient should be commenced to prevent the hypothermia. Try to lie the patient horizontally. Lying the patient horizontally inhibits the air emboli rising above, and therefore may reduce the chances of emboli reaching the brain. So you try the patient to lie down horizontally. The recovery position should be utilized in the event of vomiting, so upside down. So if the person or the patient is having vomiting, then you have to keep the recovery position. Fluid resuscitation should be taken care of. Hypovolemia often occurs in divers who are suffering from this sickness due to dehydration, increased capillary permeability, which is caused by inflammation, increased diuresis due to cold. And then you have to give the intravenous crystalloids immediately to cause the fluid resuscitation. Then coming the second abnormality, which is nitrogen narcosis. Inhalation of mixture of 80% nitrogen and 20% oxygen, which is at high pressure. So high pressure, if we are inhaling the mixture like this, then its symptoms will be. So at 120 feet, the person will feel joviality and carelessness. So that is known as rapture of the tip. At 150 to 200 feet, the diver becomes drowsy. 200 to 250 feet, loss of strength of that particular person. So it affects the musculoskeletal system. Beyond 250 feet, the brain is affected and the person becomes unconscious. The nitrogen narcosis is similar like alcohol intoxication. The nitrogen reacts with the fatty acids in the cell membrane of neuron and impairs the conduction like gas anesthetics. So it impairs the conduction and affects the fatty acid leading to these particular symptoms. The third one is oxygen toxicity. Now, if we are providing the oxygen, we are providing 100% oxygen, but if there is inhalation of 100% oxygen under high pressure, these breathing high pressure for prolonged time periods can produce acute CNS toxicity. We have seen as a treatment of hypoxia also, that is hyperbaric oxygen. So 100% oxygen, if we are inspiring for more amount of time, it can lead to CNS toxicity. So symptoms like behavior disturbance, hallucinations, syncope, and convergence. So this can happen. I have yesterday, 2 days before only, have seen that extremes of any case is hazardous to your life. And it was, I don't remember whose lecture I was listening, but the person, he said, की कुठली ही गोष्ट अति झाली तर ती त्रासदायक असते. So in any case, even if you feel that oxygen is pranavayu, but still if you are giving in excess, that can cause disturbance. And that he was telling that this is a thing which we have learned in this pandemic period. So oxygen toxicity may be fatal when underwater. So care must be made to reduce oxygen content of gas mixtures for deep dives. In decompression chambers, oxygen toxicity can be treated by withdrawing the oxygen and administrating benzodiazepines to prevent the convergence. So these are the modes of treatment if you want to prevent this. There can occur air embolism when diver suddenly returns to the surface holding breath. So he's holding his breath and he suddenly comes out. Air in the lungs increases, causing expansion and rupture of pulmonary veins. And this occurs due to rapid loss of external pressure on chest, which leads to expansion of gases inside the lungs. This can lead to air embolism. Now, these are some common things which we see in deep divers. Now, this is very common in adventurous sports also. One of the common, scuba diving, self-contained underwater breathing apparatus. So it is having a tank and wall system which is used for deep sea divers, and it contains the oxygen and helium, which is known as heliox. And these are the things which are there in this particular apparatus. Many a times a question can be asked on this particular apparatus also. So This helium has only about one-fifth the narcotic effect of nitrogen. So instead of nitrogen, if we are using helium, it will be having less deleterious effect. Only about one-half volume of helium dissolves in the body tissues as nitrogen, again very useful. Low density of helium, which is one-seventh the density of nitrogen, keeps the airway resistance for breathing at a minimum work of breathing. So it also assists. So instead of nitrogen, if you are using the helium plus oxygen, that is heavy ox, it will be useful. But the disadvantage that high pressure nervous syndrome due to helium can occur, and this HPNS is due to anesthetic effect of helium under high pressure. So this can also lead to anesthetic effect as it is liquid soluble, and this can again lead to drowsiness, tremors, in coordination, or the coordination will be lost, leading finally to brain changes, which we can observe on EEG. So this is the person I found yesterday, the picture of this one, that he has a record, the deepest scuba dive record, Ahmed Kab, 1090 feet in Red Sea. So he is the person I was just seeing what they can do. I was watching that just now, which the persons are lost, those who are working under sea. So there was a cyclone, and at that particular time also I was searching for the pictures, what actually they did at that working. But in that incident, I didn't found any picture what exactly they were doing. So I found this record that he is Ahmed Gab, that he is having the deepest scuba dive record without any deleterious effect. So I think that is all regarding this particular topic. I have only one topic which is left of respiratory system. Now this again will be applied topic. So that is the application, like effect of sedentary lifestyle on the system. So on the body, you must have seen the effect of exercise in your cardiovascular system lectures. Now what I'm going to discuss in the next session is what are the effects of sedentary lifestyle. So that will be the last session, and after that I will try to have one lecture on the early clinical exposure. So the early clinical exposure, I have actually covered many of the clinical symptoms, the clinical symptoms in my every session, but I will try to have a separate session on early clinical exposure. So thank you all.